So working at 21D, it's the most intense but rewarding job I've ever had. It's not really a job, it's more like a lifestyle choice because every element of my day is spent thinking about 21D. Before coming into 21D, I've worked in numerous hospitals, in maxillofacial departments, in oral surgery departments, but nothing comes close to the level of surgery that we do here, the level of treatment planning that we do here, and it's a full-on explosion of knowledge.
Working with implants and oral surgery previously, had some fair exposure in that. So joining here was like a complete different world. I mean, the level of knowledge you acquire in the first few months is going like from 0 to 100, almost like that.
When was it the moment that you came in here and you were like, this is it?
Walking through the door, I mean, meeting VJ, meeting the team, the environment, was like complete different to what I used to work before. I worked in a private practice, a nice practice, this, that. But here,
it's a complete different setup. We've got 2 big smart screens in every surgery room. The best face scanners that are probably on the market. And then on top of that, we've got intraoral scanners in every single room. All of our patients coming through the door, almost all of them have 100% compliance and are trusting in us and our expertise. There's no bartering in what they want and what we want. It's clinical parameters, and that is all that matters in this environment. And that blew my mind joining this company.
Not just freedom to practice truly to the best interest of the patient. It was just doing the right job in the best way I've ever seen in the world. I've been around Europe, I've been around UK, I've been around USA, so it's like I've seen things and I've never seen anything like this. So that's why it's made me stick. It was like, okay, I want to be here. I want to join.
I came in here with no implant experience, and seeing this from the full clinical assessments to the actual surgical protocol that we follow, to the post-surgery protocols that we follow, to the long-term prosthetics that we provide, I thought this was gold standard until I started looking outside.
No.
And then I've realised that
no,
we've set a precedent that needs to be followed, and I feel like this is the way it should be.
True. Teamwork that was actually going on here. So you're never alone. You have mentors like VJ, Isabella, and everyone around you that can guide you about, what to do and what everything means, not just, okay, yeah, this is it, or do that. The explaining of it, that was a learning for me. You can only do this to that level with the right team behind you, and not behind you, with you, alongside you.
We're constantly being surrounded by all avenues of dentistry and bioengineering. This is a separate department, separate building that we can go to, and we see the 3D milling, we see the 3D prosthetic design. Having that at your fingertips is
it's real-time communication we have with them. That is the greatness of it. Is like you have real-time communication with everybody. Now you have a real-time communication with senior clinicians that can guide you and learn things. And even if you do know something, there's always room to learn more. You can do things at the greatest level I've ever seen and ever experienced in my whole life. This is how it should be done worldwide.